My name is Connor Howes and today I'll be completing ACVN Practical Assessment 38, Dental Maintenance and Equipment. So we have the dental machine here and then we've got our diamond burr attached to this machine. So I am by myself, so we'll see how this goes with filming it. You have to turn it right once and then it should, one right, and it will come out just like that. You want to be very careful when handling the diamond burrs or any equipment for that matter, just in case you don't want to drop it, you don't want to cause any harm or injury to yourself as well. And then we can remove this one by going twice to the right and pulling that one off. Now we want to be cleaning the dental equipment here. So our clinic, as per our clinic policy, uses V-wipes to remove all gross contamination, foreign material, and any debris that is left over from the dental procedure with that patient. So with the V-wipes, making sure absolutely every part is white, lifting the piezoelectric scaler, and then I'm cleaning inside the holder. It does always get wiped down and sprayed with F10 afterwards. I'll be doing all of the buttons here because sometimes they get quite a lot of blood and debris on them from the vet just touching them with their gloves. Then we want to be lifting the machine, being very careful with it not to drop it. We want to make sure we're getting the pad as well and all of the cords. Now we have our F10 here, so now I'm going to give it a generous spray and spray absolutely every surface. An appropriate 10-minute contact time as per the manufacturer's instructions has occurred now, so we'll wipe away all of that residual chemical and residual F10 using some paper towels. Now I am going a bit quicker than I usually would here, just for the purpose of the video. So this is kind of our layout here for our processing area. It's very small, as you can see. So this is our sink for our instrument solution. We use liquid Pyron as our main disinfection protocol at a dilution rate of 2 liters to 2 mils. We have a squeeze pipette here for cleaning lumen instruments. We have a syringe here, and then we transfer our liquid Pyron instrument solution into this small specimen container, just because we don't have the dosing cap. We have our distilled water, a bucket of distilled water there. As per the manufacturer's instructions, we will fill now to the 2 liter line. I will then get my liquid Pyron, my instrument solution here, and I will draw back to the 2 milliliter line. We want to make sure that we're placing them below the surface and we are being very gentle when placing them in. We are making sure that they are all opened, that nothing is closed when you're placing them in, and all surfaces are exposed to the liquid. They are now in the instrument solution now, and they are waiting for a 10-minute contact time as per the manufacturer's instructions. It is very important that when we are cleaning our instruments that we are using a soft bristle brush, such as this one here, so it doesn't cause any abrasiveness to the instruments when we are cleaning them. We want to be very gentle when we are cleaning them, but we want to make sure that we are cleaning all surfaces as well. So now a 10-minute contact time has occurred here for the instrument solution. So now we will scrub and we'll clean them appropriately. I do apologize that you aren't seeing what I'm doing, but I'm getting right into the tip here of the luxator. I'm only handling it by the handle. I am being very careful with it. You don't want to be handling it from the points or the tips that can cause any injury or harm to yourself. You want to make sure that you're scrubbing absolutely every surface. Very important that it is rinsed thoroughly, and this ensures that water spots don't occur as well. Great, and we'll leave that one to dry. And now just finally with the diamond burr, you want to make sure that you're being very careful when handling it. You're not touching the point in any way, you're getting in every nook and cranny of it, making sure that everything is removed. I'm very happy with that. We'll give that a rinse. It is very important that we hand dry using a non-lint cloth, or you can dry using the residual steam that's left over in the autoclave as well. However, our clinic doesn't usually have that option. We usually have to hand dry to remove any water spots and make sure that they're completely dry. You want to be checking for completeness, functionality, making sure that they are working, making sure that they are intact, and all the pieces are together. So now we will lubricate the machine, making sure that it is running appropriately and working correctly for the next dental. We want to make sure when we are using this, we are placing the lubrication oil in the small hole. Out of the 2 holes, we want the smallest one within the dental machine. So let's do that now. Beautiful. 1, 2, 3, 4. And now we'll attach the high-speed handpiece, making sure it clicks and is on tight. Now we want to run and test the machine, running for 30 seconds, making sure that it is working and functioning properly for the next patient use. Now, that has all been run and tested there. Fantastic. So we'll remove the low-speed handpiece and we'll place that one in the dental equipment. We will pop this one to the side now, and that is all ready for the next use. It is very important that we lubricate our dental instruments and equipment in between each patient, as this maintains longevity of the equipment, making sure that it is working proficiently and at an appropriate level, and will not cause any injury or harm to the patient or staff alike through slippage or droppage of the instrument. I'm here in the processing area. We'll be sharpening a handheld scaler here and a winged elevator. Before we begin, we want to remove the sharpening stone there from its protective casing, making sure that it is well lubricated and it is clean. I like to use a bit of tension just to guide the sharpening stone here, just on the side. It must be done on a flat surface. And we're using my 4th finger, my index finger here, to keep the instrument at the correct angle and keeping it steady on the sharpening surface. Then we want to pull and just gently pull down in a pull stroke motion. And now, doing the same thing, I'll rotate it and do the other side. So we'll now set that handheld scaler to the side and we'll begin with the winged elevator. So this must be sharpened on a flat sharpening stone as well, and then we want to be using the convex side of the instrument, which is applied to the stone here, and we want to put it on a 45-degree inclination. We want to again be having our index finger on top, keeping it steady and level, and we want to be just gently holding the sharpening stone just so it is not moving out of the way anymore. We want to maintain the tip shape and make sure that it is sharp. So we want to use our wrist and our hand to get the tip wiped in a back and forth motion to sharpen it. Yeah, happy with that. We'll wipe away any of that residual there. So I have a syringe here, and we'll be using this as our test stick. I understand that we should be using an acrylic test stick to test the sharpness here of our newly sharpened instruments. However, our clinic does not have one, so I will just be demonstrating and simulating this here. The winged elevator, we want to make sure that it is not catching the acrylic test stick in any way, and that it is nicely sharpened. We autoclave our dental instruments between patients, as this reduces the amount of foreign debris, bacteria, any microorganisms that may have been left from previous patients. So I understand that we should be using 2 laminated pouches, one smaller and one larger, when wrapping dental instruments or surgical instruments for that matter. However, our clinic only has the one-side laminated pouch available, and as per our clinic policy, they only like to use the one pouch. The blunt end will be facing the surgeon, because that is the end that he will be grabbing aseptically when we open. Now we want to undo the sleeve. We want to make sure that paper meets plastic and the adhesive band is stuck all the way across the dotted line, and there is no area of escape, so that looks fantastic. There's no air bubbles. Incorrect packaging and incorrect sealing means incorrect sterility, and it won't be sterile for the procedure, and they will have to be reprocessed and re-autoclaved. So now we're going to use our autoclavable tape. You don't need an indicator strip, as it's already on the bag of these laminated pouches on the back. But just a small little strip, and you just want to place that on the front here. Now we want to be writing our name, our date, initials, and what the instrument is called. As well, you don't want to be writing on the back of the paper because that will seep through into the autoclave bag and will not make it sterile. So this has been correctly packaged and is ready to be autoclaved. Now for our handheld piece attachments. So this is a diamond burr. So now I'm going to close that one. Put the autoclave tape on. Incorrect packaging as well also means that the instrument may get damaged in the autoclave, so it is very important that they are packed correctly. I've placed that in there with the autoclavable tape. I'll now just write on it. They're all packed and ready, and I'll put them in the processing area for autoclaving. But other than that, that is everything today. That is Practical Assessment 38, Dental Equipment and Maintenance.